Hello, I'm Jessica Lovell, host of the Morning Medical Update. It is 2026, and we are so excited to see you on February 2nd when we are back with our live programs. Right now, our team is working hard throughout the month of January to bring you some really important patient stories, like the story of John Kermer. He was diagnosed with bone cancer at just 13 years old. You'd think a partial leg amputation would set this kid back. Not a chance. You're going to meet him and the specialized surgeon with a very rare solution that landed John back on his feet. And then we're working on the story of Kate Ingram, star soccer player with big college dreams. She had 3 major injuries to her legs and feet that had her sidelined for 18 months. Would she ever play soccer again? We'll tell you about a unique program designed to help get young women like Kate back to the field and beyond. In the meantime, enjoy this Encore presentation of one of our very favorite episodes.
He's struggling to breathe. His lips are purple.
Coming up, a terrifying roadside birth. How new training will help dozens of hospitals across Kansas prepare for an emergency delivery. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Imagine a mother going into labor far away from the nearest maternity unit. But it's a rural reality in many Kansas communities where hospitals no longer deliver babies. It is so common, there's even a name for it: a maternity desert. Now, a new training program through the University of Kansas Health System helps local hospitals. And here's Angie Racona with more.
Push, Mom, push. There you go.
In Oakley, Kansas, doctors, nurses, and EMTs practice something they don't do every day.
Use your fingers to kind of point toward the kid's nose.
Deliver a baby.
Lift the baby up, sweep it around on your arm, and you're done.
I personally am a very hands-on learner, so we did learn this in class, but of course it was book. We don't have mannequin like what they have. So doing the hands-on is great for me personally.
So you're going to want to put a little counter pressure on the perineum.
Deanna Slippers is with Logan County EMS. Her goal is to get mothers to a birthing hospital.
And then keep coming.
But this is the backup plan.
So now start lifting the baby up.
We do know it's a concern out here, being rural America. Things are far and few between, so it is a concern.
Logan County Health no longer has maternity care.
There's been many rural hospitals who have stopped doing OB services, including ours here at LCHS, just because of the lack of resources and not delivering enough to keep our staff competent and prepared to do that. So that's been the biggest change. I think the OB desert has grown over the last couple decades.
That's where the University of Kansas Care Collaborative comes in.
Robert's going to deliver this baby now.
It's bringing hands-on lessons to community hospitals, knowing a birth plan can suddenly change, especially when the nearest delivery room is far away.
It is a scary situation for staff and parents to be in when you don't have that training or, do it on a regular basis. So being able to get hands-on training and be prepared for it helps us make sure we have successful outcomes, but it is also scary for those parents who have to drive 45 miles one way to get to the nearest OB facility.
They need to be ready, because you may be thinking that, well, they're not going to come to our facility because we don't deliver. But if they're having to travel 100 miles from where they live to go to the hospital that they're delivering at, anything can happen in that 100 miles.
Dr. Bob Mosier leads the training.
Hands go toward the nose.
Helping nurses and doctors regain conviction in a skill they rarely use.
Then that confidence level comes back, and that's important because sometimes in a rural community, you're already shorthanded, and it's kind of all hands on deck when you have something like a precipitous delivery show up in the ED or a postpartum complication. We want those folks to be able to take this training, even though I know some of them that have never delivered and have no desire to deliver.
Through the Care Collaborative, hospitals in 79 counties will receive the same hands-on training.
As it comes out, then you want to start going upward.
Making sure every provider is prepared for life's most precious emergencies.
And And joining us now are Dr. Bob Mosier, Medical Director for the University of Kansas Health System's Care Collaborative. He is joining us virtually along with Robert Mangold, Chief Nursing and Operations Officer in Oakley, one of the hospitals participating in this program. We also have with us in studio Jody Schmidt, Executive Director of the Care Collaborative. Good morning to all of you. Good to have you.
Good morning.
Dr. Mosier, good morning, and I'm going to start with you. Just how serious is the maternity desert problem in Kansas right now?
It's getting pretty serious. It's expanded over the last 10 years, and there's really no end in sight as to who's going to have to decrease or stop delivering. As Robert pointed out earlier, as the numbers of deliveries decrease in a particular location, being able to maintain the competency and skills and actually to be able to afford the cost of delivering those low volume services is many of the reasons why some of the rural hospitals have had to choose to discontinue their OB delivery services. So I think it's going to continue to worsen. I think it's even more important to continue training like this, but to find ways to support those who are still doing, lower volume deliveries, but important services that their areas need.
It's really incredible to see that training and just being able to put that power in people's hands. Really, really neat to see. Jody, what barriers make it hard for rural hospitals to keep labor and delivery units open?
Well, as was described, part of it is that clinical competency, doing enough deliveries to be confident and capable of managing those patients from a safety perspective, but also the financial barriers when you're sharing those expensive costs of maintaining the equipment, the training, the malpractice coverage, et cetera, that's required to operate OB, and you're doing that with very, very few patients. And so we have seen in the last 10, 12 years, more and more hospitals give up those services. And as a result, distance is always a barrier in rural communities. And in some cases, patients are traveling up to 200 miles to get to the facility where they will deliver.
Wow. So, Robert, what motivated your hospital to pursue additional obstetric training through the Care Collaborative?
Yeah, so like Dr. Bob and Jody said, the maternity desert's real. So knowing that we're along I-70 and we could have an expectant mother traveling through on the interstate at any moment, we need to be prepared and competent in our skills to deliver a baby and then get them onto a facility that can handle their needs after that. So, we drill on other scenarios such as codes and traumas, but OB that we don't see very often, we haven't really had a good hands-on experience for that training. So just making sure our staff and facility are able to provide that care in those emergency cases really drove us to continue looking at other resources to provide the training.
Dr. Mosier, Robert mentioned I-70. We have a map of the Care Collaborative. Can you just tell us how far it reaches?
Well, yeah, as you look at the map, you can tell that, we're in almost 2/3 of the state. Pretty much, the western 2/3 is well covered, and a little bit more spotty around the eastern, but higher populated, metropolitan areas. So we started with 13 counties in northwest Kansas when we began our program back in 2014. And so having continued and added new sites up to now 79 counties and over 92 different entities that are part of the Care Collaborative, I think you see the need, the importance, and we're grateful to have all of our rural partners participating in this work.
Jody, can you explain what the Care Collaborative is and why it was created?
Be happy to. Our goal is really to connect the resources of our academic medical center with the rural providers across the state who care for everything that walks through the door. We have subject matter experts here, physicians who do nothing but STEMI, stroke, sepsis, OB, et cetera, all day, every day, and who have the opportunity to access the latest research, the latest clinical best practices, where our rural communities are busy, as I said, taking care of everything that comes through the door. So our goal is to say, let's bring the training to you so that we can share with you the latest recommendations. Let's bring you protocols and processes that make sense for rural, so you're not starting from ground zero. We're assisting as best we can in helping rural communities really engage in the very latest practices in those areas particularly where there's low volume but high risk. And so we started out in STEMI and stroke and added sepsis, heart failure, diabetes, and now we're very excited to be focusing on OB simulation. It's actually our nurse program manager, Karen, who you saw in the video, who also covers a critical access hospital on the weekends, who had done her first delivery in 10 years at that hospital in the very situation we're describing, who said, this is a growing problem. So we're very excited to be able to receive a federal grant to address it.
And really finding those solutions.
Finding those solutions.
And use that word, just really bringing confidence to these care providers.
Confidence, competence, a sense of really as a team knowing how they will come together and address those unexpected precipitous deliveries, and then providing the protocols and processes. So when it happens, they're not just looking at memory, but they've got something concrete that they can pull out and refer to, but they've had the hands-on with the mannequin, and this is the first time we've taken that sort of approach to simulation. It's very exciting for us.
And exciting for when a family comes in to their facility and then they know that they can provide good care for them. This started back, the Care Collaborative started back in 2014. How many providers have you trained for?
We have trained more than 8,000 providers at this point in time across all of our programs. And as Dr. Mosier said, we've grown to the point where we now have 91 members in those 79 counties. So we're passing 2/3 of the state and coming up against 3/4 of the state participating. We really believe that it's important for us to make it as easy as possible for these rural providers to engage in the training and the processes, which is why we have Dr. Mosier on the road so often, providing these trainings in the rural communities where the majority of physicians, advanced practice providers, nurses, EMS, everyone can come together and train at the same time there, as opposed to one or two people having to go away for training and then coming back and trying to share with everyone else. We really believe, and our data shows that this really moves the needle in terms of being able to provide the highest quality care.
Dr. Mosier, what does the Care Collaborative do differently to build sustainable maternity care in rural areas?
Well, that's a challenge, right? We hope that what we've seen with some of our previous programs is by having a number of participating counties that are often, near together, is to look at a little more collaboration around some of those sites that are still delivering the services. So that they can help capture the majority of those patients delivering within one area. That way it supports the more regional active obstetrical service facility. But that's challenging, because they, like others, are limited by the capacity of their staff, both in those who deliver, but also the support staff there to assist with managing the labor and delivery and the child and mother following delivery. So, we hope that we can continue to be that conduit of an opportunity, the convener, to have the conversations of particular areas. How do we continue to support maternity services in these regions?
Jody, how does the Care Collaborative help hospitals implement and maintain obstetric services?
In addition to training those facilities that have given up OB services so that they're ready for those unexpected situations, we also will be offering the simulation training that those that do provide obstetrical services, again, to help them expand their capabilities and their best practices. We've also tested a new program for high-risk maternity patients through remote patient monitoring. We have done that for a few years with Medicare beneficiaries, but never with high-risk moms who may have gestational diabetes, blood pressure issues, etc., so that we can hopefully identify issues earlier so that there is time for that mom to get to the site of delivery and catch those things early. And so it's something that we have been partnering with Citizens Medical Center in Colby on for the last year and are excited to be able to begin expanding as well. And then, as Dr. Mosier said, this idea of really regional planning so that there's a good sense of how do we work together to expand and sustain maternal services. So we've done some work with providers initially in Southwest Kansas, really looking at the data to say, okay, I as an individual facility may not have the volume to provide OB services, but perhaps if 3 or 4 of us came together, we could begin to explore how we could add more OB resources in rural communities.
So Robert, how has the training changed your confidence and readiness to deliver babies in your community?
Sure. I mean, just like Dr. Mosier and Jody talked about, it really just increased that confidence in our staff doing that hands-on. I mean, we do lectures and, online education, but really getting to do the hands-on training was phenomenal for our staff, and we're very grateful for Dr. Mosier, Karen, and the whole Care Collaborative for helping set us up for success and to take care of those expectant mothers.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. The March of Dimes says that more than 32% of all the counties in the United States are considered maternity deserts, which means they have limited maternity services or no services at all. The problem is even worse in Kansas. More than 45% of counties are considered maternity deserts. A Kansas mom living in a maternity desert recently shared her dramatic story with KCTV5.
You can learn a lot about a community from its local paper. On March 6, 2024, the headline for the Miami County Republic read, "I just delivered my baby." The sheriff posted about the roadside birth on Facebook too.
I just delivered my baby.
And from there, the story just grew.
Everyone's like, yeah, congratulations, but it was a scary situation.
We were terrified.
It's hard to understand what it was like in a car alone in the dark until you listen to the 911 call.
So we are northbound on 169 highway. Sir?
Labor began at 3 in the morning.
We have to go like now.
I have no idea what you said, sir. I'm sorry. Okay, that's all right.
Danielle and Riley raced to Olathe Medical Center more than 30 miles away.
We can get there.
They passed a smaller community hospital with no birthing unit.
Sorry, we're in a dead spot where I don't know what to do.
Danielle realizes she'll give birth in the car.
Get the baby now. Catch him. We're sending help over there. Stay on the line. I'll tell you exactly what to do next. I got him. The baby, okay, is the baby out? Hi, baby.
This emergency is just beginning. It will be more than 11 minutes before medical responders arrive.
He's not breathing. Yeah. Okay, he's having a hard time breathing. Listen to me. Gently wipe the baby's mouth and nose, and then vigorously dry the baby with a clean, dry towel for at least 30 seconds.
A family on the side of the road with no towel, no blanket, no suction, and a baby struggling.
He's struggling to breathe. His lips are purple. All right, I'm going to give you instructions on how to give mouth-to-mouth. Completely cover the baby's mouth and nose with your mouth, then blow 5 puffs of air into the lungs, about a half second each, just enough to make the chest rise with each breath. Go ahead and do that now.
If you're impressed with how clear and calm the directions are,
okay, do it again. Yep.
That's because this emergency birth scenario has played out 3 times in 1 month for this dispatch unit.
Just enough to make the chest rise. Okay, did you feel the air going in and out? Yeah. Okay, he's crying now.
She sounds so scared.
Dr. Emily Matheson is Danielle's doctor. Instead of delivering Frankie, she met him in the hospital.
Just to have someone tell you what to do over the phone, that's horrifying.
How dangerous is something like this when you're delivering on the side of the road and you have no supplies and this was not the plan?
Yeah. I worry about, a baby could get stuck, and sometimes will require maneuvers to be able to get delivered. Sometimes moms will bleed heavily after delivery, and that can require medications and other interventions.
Dr. Matheson has patients who live 90 minutes away. They live in maternity deserts. And even if there's a community hospital, there's no birthing unit.
We just knew he was blue.
Danielle is a nurse, but her specialty isn't labor and delivery.
But then he was gurgling because he had all that amniotic fluid. His face was smashed.
In the dark, Frankie's coloring was concerning. Turns out Frankie was bruised. That's because the delivery was so fast.
It's just emotional because, you know, we're crying for help, hoping someone shows up to make sure everything's going to be okay. Sorry.
There was no blanket and no towel when Frankie was born. His dad wrapped him in a Chiefs sweatshirt.
Oh, goodness.
Riley wore it the day we met Frankie. And then Frankie and his family took it on the newborn photo shoot. Back to the highway where he was born. Quite a story down the road. Quite a lesson for now about moms in maternity deserts.
What a story. Dr. Mosier, what are the most common complications you worry about in women who travel long distances for delivery?
Yeah, you heard a few of those. You know, one is that the head delivers, but the shoulders don't follow. You know, what we call shoulder dystocia. That can be quite serious and really impact both, obviously, the baby and mom. And then the other would be, you know, postpartum bleeding or postpartum hemorrhage. You know, things that really are emergency, that are time critical, that someone, you know, with the right skills needs to intervene to improve the outcomes. And so those are certainly things that we always worry about. And you never know. You know, there are averages of how long does labor last and when can you expect the delivery to occur, but those are averages. And so you can never guarantee that, you know, things are going to follow along those lines. And so as those distances increase, the likelihood of more deliveries alongside the roads and whatnot and complications that can come with that will be increasing. So it is a concern.
How could couples, parents, mothers, fathers prepare? What advice do you have in the event something like that could happen?
Yeah, we always, you know, talk about go bags, you know, so that when labor hits, you've got, you know, your makeup kit, your clothes, change of clothes and things like that that you want to pick up and grab the baby's first clothes to, you know, wear and to take them home in. But those go bags, yeah, need to have a few other things. Obviously, if you're looking at having to travel more than 30 minutes away from where you live to where you deliver, and including, you know, some of the things you heard, you know, nasal bulb for suctioning, a towel for drying the infant, a couple of good clean shoestrings for tying off the umbilical cord would be wise. And so I think as we look at these maternity deserts widening out, the distances increasing, I think, you know, we need to be mindful about prepping moms and couples for being prepared for the what if, you know, occurs alongside the road.
Robert, what obstetric emergencies did your training emphasize?
Sure. So the Care Collaborative prepared us for a wide variety, you know, the straightforward imminent birth happening in the ER up to those emergency situations like Dr. Mosier talked about, the shoulder dystocia, a breech baby, so delivering feet first, and then those post complications such as hemorrhage and shock. So we covered kind of the full spectrum to be prepared for any of those cases and be able to stabilize mom and baby, hopefully, and get them onto a birthing facility.
Jody, I can't help but just I think about Frankie's dad delivering him on the side of the road like that, and just the emotion that went into that story. What would it take to eliminate maternity deserts altogether so we don't have to hear those stories? What a wonderful outcome, but you know, we can't count on those all the time.
Absolutely. There's no easy answer to be frank. We would need a lot more physicians who are delivering, more training for family medicine physicians intending to practice in rural areas around OB services, expansion of more OBs available, particularly in rural hubs that serve an entire region. The ability to, for example, Dr. Brost and the maternal fetal medicine team who developed the curriculum we're using in this training are also training ultrasound techs to be able to provide that support in the rural communities. I mentioned the remote patient monitoring and regional planning and coming together to figure out how together small communities can begin to expand services. There's not one single easy answer, but fortunately there are a number of efforts across the state of Kansas and across the country really saying we've got to figure out more resources, more ways to identify how we fill these gaps in the rural communities.
Certainly with the work that you and your team are doing.
Yeah, absolutely.
Dr. Mosier, how does remote support from specialists improve safety for rural physicians delivering babies?
Yeah, that remote support can go a long ways. Just sometimes what we call the curbside consult, where you might be experiencing some challenges with what you're observing in either the progression of mom's pregnancy or maybe during delivery, labor and delivery, being able to just call the specialist to run a few questions by to how to maybe go about managing some of those conditions. That can be very helpful. The training that they're helping us in designing and delivering is also important. Again, as Jody pointed out, these folks are doing this day in, day out. And in some of our rural communities, they're delivering, fewer than 60 babies a year. And that's just challenging for staff and providers to keep the skill sets up. So, I think even some of the programs that the Care Collaborative have used in the past, which is including, the telemedicine TV in the emergency room where you have an emergency physician and a critical care nurse who can be there observing and talking the staff through, the process of managing the patient's care, which would include, even a precipitous delivery or postpartum complications. So I think, the expansion of telehealth, telemedicine, some of the remote monitoring equipment, I think all that's going to be helpful, but it still, doesn't necessarily address the challenge of time and distance that we're seeing increase in getting access to some services.
Well, we want to get to some questions and comments from our viewers this morning. Jeremy says, as a dad, that 911 call got me pretty emotional. I think we're all with you there, Jeremy. He says, all my kids delivered so fast that our OB trained me a little on delivering a baby just in case we didn't make it to the hospital when we were having our third child. That confidence is such a big deal. So thanks for doing what you do. Ruth Ellen wants to know what other areas of healthcare support are lacking in rural areas.
There are a number of areas where we work with our members to identify those needs. We're expanding in behavioral health, and we've recently been very fortunate to receive a grant from the Patterson Family Foundation to extend and create what I've been calling a virtual campus, where we have pulmonology, neurology, rheumatology, other services that aren't available in the rural communities that we can provide via telehealth. So we're just getting ready to launch that at the first of the year. And then we continue to work with our members to say, what are the other gaps that we can help address? What are the greatest needs across rural Kansas?
Amy wants to know, what exactly qualifies an area as a maternity desert?
I believe the definition stems from the population versus the number of providers who are actually providing OB services, is the formal definition. But like all definitions, I think right now the federal government has 4 definitions of rural, and it depends on which program. And so the OB deserts are very similar in terms of the definition. But the reality is it's a focus on how far a mother must travel in order to receive OB services.
Dr. Mosier, Karen is asking, how common is it for an expectant mother to find herself in an emergency situation?
Well, it's a great question. And if you just look at the literature overall, I mean, the likelihood of having a shoulder dystocia delivery, is 2 to 3% of total deliveries and whatnot. Postpartum hemorrhage, complications average about that same rate. Which again, those are just numbers, but when it happens to you, that's that's critically important, and why we think, even though in some cases these are low frequency but high risk, why it's important to at least have a process and protocols in place to kind of fall back on to help you remember your training and the techniques in managing something like these precipitous deliveries and whatnot. And so we think, even though the risk is low in some cases, and a majority of pregnancies, turn out just fine. What we're most worried about, though, is just the fact that the time and distance between where you live and where you receive the services, with those increasing, then that means the risk of complications go up just inherently.
Dr. Mosier, as we wrap up today, what do you want the biggest takeaway from our conversation to be?
I think, that recognizing there are challenges out there and then finding ways to address them, and that takes collaboration and cooperation across a number of entities. And so we're really thankful as a Care Collaborative to have our partners willing to work with us and to give us suggestions and ideas. And then our academic medical center with supplying, the subject matter experts and listening when we have questions, and also listening when we tell them, rural healthcare delivery is completely different than what you're used to day in, day out. With all those resources surrounding you, it's much easier, but you need to think about these things in the context of how our rural providers are practicing.
Dr. Mosier, thanks for your insight this morning. We appreciate you being with us. Robert, what's the big takeaway today?
I think the big takeaway for us is preparedness is key, whether that be parents being prepared, like Dr. Mosier stated, having those to-go bags, and facilities that don't do OB services being prepared. So, just preparedness, drilling your staff, and proving that competency so we have good outcomes is key.
Absolutely. Thank you so much for being with us today. Jody, wrap us up on this Friday. What do you want people to really take from this conversation? A really good one today, by the way.
Thank you. I believe that what it emphasizes is that we have challenges, distance, time, or barriers in rural Kansas, but if we come together, we really can start to address those challenges and make certain that we are not only identifying the gaps, but finding creative, innovative solutions for addressing them.